Sleep is critical to our daily lives and to the healthy function of our body. Without it, our memory fails, our temper deteriorates, our head hurts, our attention diminishes, we perform poorly at work, and our personal relationships suffer. However, we often pay very little attention to the amount and quality of our sleep. I'm Dr. Jordan Stern, the founder and director of the Bluesleep Snoring and Sleep Apnea Centers. For the past 10 years, we have used innovative technology for the home diagnosis of sleep apnea. Sleep apnea is a disease that affects millions of Americans, yet 90% remain undiagnosed.
I was diagnosed with sleep apnea about 12 years ago and went to see several doctors. One of them wanted to operate, and being a singer, and the operation would have been, very dangerous to the vocal cords. I mean, it just was not a risk that I even considered.
I'm 37 years old, and about a year ago, I decided that being single with sleep apnea and some moderate snoring was probably more than I wanted to deal with at the time.
What really was the catalyst to get my butt in gear in terms of addressing this was my wife. She was complaining of snoring to the point of gargling, in terms of, you're not sound like you're snoring, you sound like you're losing air.
I'd gone to my primary care physician for a checkup. He examined me, thought that I might have sleep apnea, and sent me to Bluesleep to test for sleep apnea.
Sleep apnea causes daytime sleepiness and fatigue, difficulty focusing, headaches, memory loss, mood swings, and is associated with serious medical conditions such as high blood pressure, heart disease, stroke, diabetes, and obesity. People with untreated sleep apnea are at higher risk for serious motor vehicle accidents and job-related accidents. That's why it's really important to be diagnosed and treated if you have any of these signs and symptoms. But how do you know if you have sleep apnea? Home sleep testing can tell you right away.
My boyfriend of the time did tell me that he was experiencing a lot of sleepless nights with me because of my moderate to sometimes heavy snoring.
I've been smacked in the middle of the night, which is kind of brutal. Waking up when your partner smacks you. I woke up one morning and saw earplugs in my girlfriend's ears, and I thought, what's going on here? What's going out of your ears? She goes, you snore. Did you know you snore? I didn't realize it was that bad. She couldn't sleep.
Sleep apnea and snoring are caused by a narrowing of the nose and throat. That's why at Bluesleep, our sleep specialists are also ear, nose, and throat doctors. A critical part of the evaluation is an examination of the inside of your nose and throat called a nasal endoscopy. A miniature camera will be used to evaluate the inside of your nose and throat. This is a very simple and painless procedure that takes less than a minute and gives us important information about how much space you have in your nose and throat for breathing. People who come to Bluesleep often ask, which is the best treatment for sleep apnea? The answer is the treatment that works best for you. That may be weight loss and diet changes, minimally invasive surgery in the office. It may be custom-made oral appliances or CPAP for severe sleep apnea. In many cases, it's a combination of treatments. And Bluesleep is the only center that offers all of these treatments.
Dr. Stern did talk to me about my choices. So we did talk a little bit about the benefits of CPAP, which I expected, and we did talk a little bit about the benefits of surgery, which, quite frankly, I was also hoping for. After the surgery, I noticed right away, I was very excited even that first night that I was out of the hospital to see if I had been snoring. And I hadn't. From the very first night out, I think I could tell that my sleeping patterns were completely different. So I was elated.
Dr. Stern's diagnosis was that I had positional sleep apnea, and he prescribed a device called Zoma, which was essentially like a strap with a foam back that prevents me from rolling over on my back in my sleep. Began using it as soon as I got it, and I could tell the difference just from not being tired during the course of the day. It was literally like night and day, the difference.
What brought me to Bluesleep was an oral appliance. And Dr. Stern, in turn, asked me about my history. And I had told him I was a CPAP customer, if you will, for at least 4 or 5 years. He mentioned a combination. I didn't even think about using both devices at the same time. And I think the combination of the two has made me feel a lot better.
The very first night, that night, after I met Dr. Stern, I had dinner, and I decided, okay, I'm going to start now. I'm going to start with the acid reflux diet now. And that's what I ate that night. I ate an early dinner and did not snore that night. And I'd been snoring every night up until that point. And so I noticed the effect was immediate.
Dr. Stern suggested this oral device. Within the first day, my fiance, who heard my snoring quite loudly, said, "It's amazing. My snoring had completely stopped, and I woke up with so much more energy." And I realized that for years, I had been living on a lower level of energy. Now, I happen to be an energetic guy, so I compensated with a lot of coffee in the morning. But this was quite dramatic, actually.
Don't wait. Come in today, have your sleep study tonight, and you can begin treatment tomorrow. Remember, there are many treatments for sleep apnea, and we offer them all here at Bluesleep.
I feel more refreshed during the day. I have more energy during the day. I don't feel tired at 3 o'clock or 2 o'clock. I'm sitting at my desk.
Another thing you might be interested in, for all of you men out there over 50, that after I started using my oral device, my sex life vastly improved.
My life has changed since the surgery in a few ways. And I think one is relief, that I actually don't feel that I have to sleep apart from people while staying in hotel rooms.
It's just amazing the difference that I feel. Now I feel fantastic.